Okay, let's talk about chronic bronchitis. Okay, so you have to understand what is this chronic bronchitis is. Let me explain you this thing. Okay, so as we have discussed earlier, this is your airway, and if I say this is the lumen, okay, and this is the, I'm making the airway. Rupa, did you share any file in the group?
Yeah.
Which file it is? Can I have a look? Can I look at this file?
Can you maybe
Good. Oh, CPAP, BiPAP. Yeah. Yeah, cool. Alexa student who put efforts and make things easy for me. Okay. So what is this? So this is your, what is this? Which layer is this? Just the first lecture I have taught you. What is this? Anyone?
This is airway.
This is the airway.
The
And the
lumen.
cross-sectional view of an airway. I'm just making a cross-sectional view of your trachea. So this is your mucosal layer. You can call it submucosal layer, and this is your muscularis layer, and this is your adventitious layer. Okay. This is what you know. Do you understand this thing? Okay. Understand one thing. This is made up of columnar epithelial. And there's cilia present. If I cut your airway like this, if I just cut you over here and see the cells, it will look like this. Okay. Okay. Now what happened? Over here. Over here, they will produce mucus. Yes or no?
Yes, ma'am.
Okay. So mucus will travel
Yes.
into this lumen. Okay, this is actually normally what is happening in the body. So what exactly happened in chronic bronchitis? It is a persistent cough with exponent. It is a persistent cough with exponent more than 3 months a year from last 2 to 3 years. Exactly, let me explain you more. So you can write a persistent cough
With exponent.
More than 3 months a year. More than 3
So-
months a year. Lasting from last 2 to 3 years. So a persistent cough with exponent more than 3 months a year from last to 2-3 years. So what's happening? A patient is coming to you and saying कि मुझे ना बहुत ज़्यादा खांसी होती है. I'm just coughing from I'm having cough like since 1-2 months continuous. Sometime I'm having it more, sometime less. So persistent cough from 3 years, like 3 months. Okay. For an year. So like कभी होती है कभी नहीं होती, कभी होती कभी नहीं होती. The patient, the classical sign and symptoms. And if you take the history of the patient will say कि अच्छा ना बहुत सालों से हो रहा है, पहले बहुत कम होता था, थोड़ा बहुत दवाइयां लेती थी, मैं ठीक हो जाती. So the patient have a classical history of this, and the patient will come to you with if you ask more history of a patient, the patient will say that I am a smoker. The patient will have an history of smoking associated with. Okay, are you at a point that you ask the patient what your history? The patient will say, I'm having cough since so many days, so many months. So if you ask more history, the patient says okay, the last year I also had the same problem, but I took some medication, some over-the-counter medication, it went, but now again I'm having this again I'm having this cough. So this is exactly this case is of chronic bronchitis. And when you will study about chronic bronchitis, here come an exactly pathophysiology of disease is when a patient inhales smoke. When a patient is patient is smoking since a long time, since a long time. So okay, let me add one more thing. The patients of chronic bronchitis comes with an usual age of like 40, 45, 50s. So this progression of disease will show at this period of their lifetime. Okay, so what happened? They were smoking. They were smokers since a long period of time. Okay, so what basically present in the smoke? Can anyone tell me what is smoke is?
Nicotine.
Nicotine, yes.
Steam, tobacco steam, which is very harmful for the lungs.
Ma'am, it has nicotine, it has tobacco.
Yes, nicotine, tobacco, and some soot particles, some strong chemical. Okay. Do you know about two things in India or Pakistan? I think it's very, very common in the side of India. So we have BD, we have cigarette. Yes or no?
Yes.
Yes,
Yes.
What is the difference between a BD and a cigarette? Anyone knows?
BD, I
No,
think not having any filter,
Yes.
but cigarette having filter.
Yes. So the companies which make smoke or they sell you cigarette, but they say, "Ki take my cigarette or take my BD. I have a better filter, so you might get being protected by cancer or more better, but you still have cancer. But if you use my filter, you will get less cancer. If you use BD, simple BD of 2 rupees, you will get cancer. In the both way, you are getting cancer. So there is no going back. So they fool us like this way. Okay. So what happened? When you will inhale smoke, so smoke act as a trigger. Smoke act as a trigger. So this gland will increase in number. Okay, this gland will increase in number because they understand that for us, for our body, smoke as an act as a very damaging to the body. So in order to protect our body from the smoke, our glands increase in the size. Okay, so there's two things happen: hyperplasia is happening and hypertrophy is happening of your glands. So two things is happening due to smoke. Hyperplasia means, what do you mean hyperplasia? Anyone?
Ma'am, increasing the number of cells.
Very good. Plasia means increasing in the number of cells. What do you mean about trophy? Hypertrophy?
Is increase in the size.
Very good. You know, have you ever like what is a tropical trophy? Trophy means increase in number. Okay. Increase in the size is your trophy. Trophy means the size will increase as well as number of your cells will increase, and there will be increase in the size and number of these small mucosal glands. Okay, and then they will get in highly activated. They produce lot of cough, and cough will trigger your cough center. Okay, when there was something in the mucus, there is a cough center in your medulla. Okay, so you will cough so much. Okay, so this will increase in mucosal layer, and this will hence increase in your secretion. So do you understand what exactly chronic bronchitis is?
Yes, ma'am. Yes, ma'am.
So what is the classical causes of this disease, chronic bronchitis? Smoking. Okay. One thing I'm giving you homework, when I will give you break after 20 minutes. So you will learn about Virchow triage or triangle. Will you learn about Virchow triangle? Everyone, I will ask everyone individually. It should be in your notebook, this Virchow triangle. Okay. They will you understand what smoking exactly does to your body and how harmful it is. Okay. Rosaline?
Yes, ma'am.
Okay.
Yes, ma'am.
So smoking is number one cause. Yes, smoking is number one cause. Apart from the smoking, you have one thing called as bisonosis. Bisonosis, you can call it anything. This is the spelling. Okay. So basically, BYSSINOSIS. Listen, I'm not good with handwritings. So please, you have to just bear with me. Either I
Ma'am,
can change
Mine
my
is
handwriting.
worse than
Sorry?
Is it possible for any factory, a steam or a huge level of chemical factory, they producing a steam, or and their employer are affecting from a COPD?
Yes,
There is
that's what I'm
another
talking
cause.
about this thing. No, so what happened? This apart from smoking, smoking is one more cause. But apart from smoking, this is called as biognosis. It is basically happening in the cotton mills. Okay, the
Okay.
cotton mills. So what happened? This cotton mills, they use the cotton when we just beat the cotton. I don't know what we call it. When we just want to make the cotton more fluffy, when we beat this, so the particles diffuse in the air when it goes into our airway, and it can cause COPD. Smoking,
Okay.
biognosis,
Yes.
infection can also cause. So
Uh,
bacteria, yes.
yes, respiratory infection, recurrently.
Yes, recurrent infections, recurrent respiratory infections. But in your Nclex, you will, most probably they're going to ask about smoking. So smoking is the number one leading cause of chronic bronchitis. Okay. So what basically is happening? Okay. You understood the pathophysiology. You understood the causes. Can you just tell me the signs and symptoms?
Cough,
Difficulty in
severe cough,
breathing,
Yes.
Shortness of breath,
Difficult.
And there would
wheezing
be
होगा, shortness of
dyspnea,
breath होगी,
severe
tiredness
cough,
होगी.
Wheezing. Very good. Wheezing.
हाँ,
Persistent
wheezing.
cough
persistent
with
coughing
sputum.
with exporant.
With
Product
exporant.
thickness होगी,
Yes.
जिसमें white, yellow, green sputum होगा.
Yes. Recurrent respiratory infection. What happened? Basically, okay, listen, how you were having respiratory infection. Okay. So due to the smoke, there was so much of due to the smoke. So in your airway, there is so much of smoke. Due to smoke, there is so much of sputum. So what will happen? This sputum will stay in your airway, and then the bacteria from we are living in environment, so there are so many bacteria around us. So when we inhale bacteria, usually we do, so they will get stick to this sputum, they will get a breeding ground. So what exactly bacteria want? They want food, water, shelter, and reproduction, the basic human need. Same needs are with the bacteria also. So they want food, nourishment, shelter, water, reproduction. So they will do the same thing. So they will sit, they will eat, they will drink, they will enjoy party, they will reproduce, and you will get, and in order to reproduce, and this order, when they are doing their parties in your airway, so they will produce exotoxin, which is very toxin for us, and we will get sick. Okay.
Yes.
So we are giving a breeding ground for bacteria. Okay, come on, you play with my lungs and my alveoli. This is all for you. Okay. So we don't have to do this thing. Okay. Infection. Okay. Apart from infection, we have a recurrent respiratory infection. Okay, one thing I want to make sure that you understand this thing. It will have a classical feature of blue blotters. Acha, what do you mean by blue? Is this blue for you?